Hello everybody. Here we will be talking about the heart, the very basics of it, how it functions, what signals it sends, what does it mean to have cardiac disease. The heart is a simple muscular organ located in the left side of the chest, the size of a fist, and it works non-stop in our life. If it ceases to work for 3 to 5 minutes, we cease to exist. It is divided into 4 chambers, 2 on the right and 2 on the left, and is guarded by valves for a directional flow of blood. And how does the blood flow? Well, blood is collected from all over the body by structures called veins, which send it to the right side of the heart, and from here the blood is pumped to the lungs to pick up oxygen, and this oxygenated blood is sent to the left side of the heart, and from here it is pumped all over the body through channels which are called as arteries. So circulation is a closed loop with the lung and the heart as intermediaries. For this function to happen, the heart needs to beat continuously, contract synchronously, rhythmically to be an effective pump. How does it happen? Because the heart has its own power supply and power connections. The pacemaker or the power station can be called the SA node, which sends down electrical signals to the AV node, which can be considered as a transformer of the heart. The current holds here a little, and then it is supplied all over through an electrical mesh to the muscles of the heart. This happens in a synchronized fashion. The SA node is also responsive to our needs. So when the oxygen demands increases, the heart beats faster to meet this oxygen needs, and that job is done by the SA node. We know that the heart is supplying blood to all over the body. It contains blood all the time. But that blood is not enough to perfuse the muscles of the heart. So the heart needs its own arteries, its own channels to keep supplying it blood all the time. And who does this? The coronary arteries. Called coronary because they are like a crown on the heart. 3 major sets are there, 1 on the right, 2 on the left, with some overlap in between. So maybe one territory is supplied by the other when there is some deficiency. But in critical occlusions, this may not be enough. Whenever we talk about heart disease, we usually mean coronary artery disease or ischemic heart disease. And what happens? As we age, blocks start to develop in the coronary arteries because of a process called atherosclerosis. It can be considered as an aging process, but it becomes accelerated in some people, unpredictable in some people. And what happens when there is a block in the coronary artery? The blood flow decreases. If the blood flow is not adequate to the needs of the heart muscles, they start causing symptoms, and the most important of which is pain. When does this pain come? Generally on activity or aggravated by activity, because we know the oxygen needs increase with activity. And when we take rest, it is relieved. This is called classic angina. Pain on activity, relieved by rest. And how does the pain happen? How does it produce symptoms? Well, the pain is felt in the middle of the chest as a sense of heaviness, constriction, maybe some kind of weight, some kind of discomfort, which is really bad to experience. Something maybe you may not have experienced before. Some people may just complain of suffocation, some burning and bloating. So they may misinterpret it for some kind of acidity, GI symptoms. This you should be very, very careful that you do not miss a cardiac pain for acidity. This pain can be felt in the neck, in the jaw, in the arm, the left hand, the back between the scapular blades and the abdomen above the umbilicus. The pain can radiate to all these sides. Sometimes these are the only sites where the pain is felt, so-called atypical chest pain, very common in the elderly and in women. So you should be careful when you experience sudden onset pain, especially if it comes on activity in these areas. Chest pain is something which directly attributes it to the cardiac condition. It directly tells you heart is a diseased organ. But some people with diseased heart have other symptoms, symptoms of inefficient circulation. Those are fatigue, lethargy, breathlessness, and here it requires greater workup. If chest pain is present with any of them, they do point to the heart as a diseased organ. All was good if it happened like that. The heart gives us timely signals, we appreciate it, go to the doctor, get a correction in terms of some medicine or some procedure, angiography, angioplasty, a bypass surgery, and win the battle, continue to live, because cardiac interventions have really added a lot of years to life. But all is not so predictable. The pain may be unpredictable. Sometimes it may come for the first time as rest itself, so-called unstable angina. And maybe this is because we never exerted ourselves. Our oxygen demands were never tested. So the pain had to happen at rest. Exercise helps you here. It helps you pick up the cardiac symptoms earlier. For some, the first attack could be a severe one. This is known as an acute coronary syndrome. Here what happens is the block is so significant that the blood flow diminishes significantly. The heart muscles start dying. Even you can be dead in a few minutes. And how does that happen? That happens because of a disturbance in the electrical activity of the heart. You can just drop dead over minutes. First onset of symptoms, and you may not reach hospital. That happens with 50% of patients with an acute coronary syndrome. They may not reach hospital. To survive this condition, what you need is cardiopulmonary resuscitation. What you must have seen in films and videos, somebody thumping on the chest and trying to revive the heart, get it beating again. That is how bad an acute coronary syndrome can be. If you're lucky enough and reach the hospital, there is something we can offer in terms of a clot busting drug or in terms of a procedure, angioplasty, angiography, whatever. So whenever you have these symptoms, especially pain which is unrelieved, severe, doesn't go away with rest, rush to a medical institute. You may not have the time. The patient appreciates the symptoms, reaches the hospital, that is fine. I also want to know how to prevent heart disease. What are the risk factors? What are the tests? What are the interventions that I can do to protect my heart, to save myself from these catastrophes? Well, we will talk about this in our next video.